You just returned from surgery with a stitched wound. Your doctor gave you a long list of instructions to follow at home. Now your job begins from here. You will be expected to clean your wound, protect it from infection, and monitor it closely until it heals. One way is to do it casually, the other is to be ready with an organized commercial or homemade first aid kit to do your job diligently. Why a stitched wound first aid box matters. A stitched wound can look stable on the outside while still being vulnerable to infection, reopening, or delayed healing beneath the skin. Having a dedicated handy first aid box for stitched wound care helps you respond quickly and hygienically rather than improvising with household items. Benefits of a stitched wound first aid box. People usually forget they have a first aid box when things are normal. However, in emergencies, having it handy helps you in the following worst-case scenarios. 1. Having it helps reduce infection risk. Fresh stitches create an entry point for bacteria. A proper wound care kit helps keep the area clean, dry, and protected during dressing changes. Even minor contamination from unwashed hands, reused gauze, or dirty scissors can increase the risk of infection. 2. Having it helps prevent a wound from reopening. Without proper dressings or tape support, movement and friction can pull on stitches. A first aid box gives you the means to secure and protect a wound from reopening while you go about your daily activities, whether you're walking, sleeping, showering, or just carrying on with your routine. 3. It helps you monitor healing. A prepared kit encourages you to perform regular inspection of the wound for redness, swelling, pus, bad odor, fever, and increasing pain. Early detection can prevent serious complications. 4. It saves time during emergencies. If a dressing suddenly becomes wet, bloody, or loose, you can immediately replace it instead of delaying care, searching for supplies, or waiting to go to surgery. 5. It supports proper aftercare at home. Many stitched wounds heal mostly outside the hospital. Good home care often determines whether healing is smooth or complicated. First aid box essential items. Here's a list of essential first aid items along with some optional extras to help keep stitches clean and lower the risk of complications. Sterile gauze pads are used for applying gentle pressure, absorbing drainage, and covering stitches to protect from dirt. Non-adhering dressings, Adaptic or Telfa, are used to prevent the dressing from sticking to sutures, wounds, or newly forming scabs. Elastic bandages are used to provide support if the stitched area is on a joint. Cotton balls, swabs for applying ointments or cleaning edges. Medical paper tape is used to secure dressings without pulling on stitches or irritating the surrounding skin. Sterile saline solution is used for gentle irrigation without damaging sutures. It is essential to gently flush the area to remove debris or dried blood without using harsh chemicals. Do not use antiseptic solutions such as hydrogen peroxide, iodine, or alcohol because they can damage healing tissue and delay recovery. Alcohol-free wipes are used for cleaning the skin around the wound. Never use rubbing alcohol directly on an open or healing wound, as it delays the healing process. Antibiotic ointment reduces infection risk. Your doctor may also recommend it to keep the area moist. Hydrocortisone cream soothes itching or irritation around the wound. Antibiotic tablets or capsules prescribed by your doctor for infection prevention. Paracetamol to manage fever and over-the-counter pain relievers such as ibuprofen. Cold packs can be used to reduce swelling around stitched areas. Medical shear, tweezers, or small scissors are used for removing debris from the surrounding area or cutting tape or dressings. Thermometer to monitor fever. A fever may indicate infection. Alcohol-based hand sanitizer and disposable gloves are used to maintain hygiene while handling wounds. Plastic disposal bags for safe disposal of used dressings. Suture cutters, optional, are specially curved, sterile blades used by doctors or patients instructed by a doctor for painless stitch removal. Your written wound care instructions, emergency contact numbers, and last but not least, a printed list of essential items and their uses adhered to the first aid box. Homemade first aid boxes. Now that you know the essential items of stitched wound care, you don't necessarily need to put them in a fancy commercial first aid box. An old wooden box or a shoe box can be converted into a professional-looking first aid box after cleaning and sanitizing. Risks and precautions. There are certain risks involved when making use of a first aid box, and some precautions need to be taken. For example, do not apply alcohol directly to stitches. It can delay healing. Avoid tight bandaging. It may cut off circulation. Check daily for signs of infection, redness, swelling, pus, and fever. Replace expired supplies regularly to ensure effectiveness. Storage tips. Keep the box in a clean, dry place, easy to access, away from children, and regularly restocked before items expire. Who should you keep the first aid box for? A stitched wound care kit is particularly important for children, elderly people, people with diabetes, smokers, individuals with poor circulation, and anyone recovering after surgery. When should you not use your first aid box? Seek professional care immediately if you notice spreading redness, thick yellow-green discharge, fever, stitches coming apart, severe swelling, persistent bleeding, increasing pain after initial improvement, deep or jagged wounds, and if you haven't had a tetanus shot in the last 10 years. A well-prepared first aid box does not replace medical care, but it greatly improves the safety and quality of wound healing between doctor visits. Your health comes first, and timely actions can save you from serious complications. Therefore, act, prevent, and heal. If you found this helpful, hit the like and subscribe buttons, share this video with someone recovering from surgery, and always consult your doctor if you're worried about your wound. Stay safe, stay informed, and heal strong. Ask questions if you have any. Thanks for watching.